Hey everybody, I'm Tim with Rejuven Joint Care. I'm here with Quinton today. Glenn is a patient. He has volunteered to just have a conversation about his story. And thank you, Glenn. I really appreciate you coming in and
Thank you for having me.
and joining us today. So first, Glenn, just tell us a little bit about what you do in your profession. What kind of day do you have when you go to work? What kind of things you do?
Well, I've built houses for 40 years, so we're crawling in crawl spaces on top of them. Half my time, sometimes it feels like I've been on my knees all my life, just doing the job.
Sure.
And so, it's been a known fact that construction is not nice to the knees.
Right. Pretty hard on the body, I'm sure.
So, in the recent years, I've gotten more into roofing.
Okay.
And when I first noticed that something was going on, I was on it wasn't really steep roof, but it felt like my knee like it was going to give out.
And so is that what made you decide to come see us?
Well, actually, I stepped on a painted line on a wet day in a parking lot, and I slipped, and instead of falling, I caught myself. And that's when my left knee really started causing me a problem. And within 4 or 5 months, I couldn't walk.
Wow.
There was no getting on a roof. And so I went to the doctor, and they basically just wanted to do knee replacements.
Mm-hmm.
And I knew there had to be something else. And a friend of ours, who also comes here, had told me about you, and so that's when me and my wife came and you explained what was going on, and I was like, you know what, I may have to have a knee replacement someday, but if I can kick that can down the road, that's what I want to do.
Perfect, sure. Well, I'm glad you came, and tell everybody a little bit about what it was like coming, and what kind of experience you had when you first started. We see people initially and do a physical exam, and then we kind of get the program started. So tell me about how you felt. How was it here in the office? How was it, the experience?
It was it's a real inviting atmosphere that you have here, which is it's the opposite of every doctor's office I've ever been in.
Awesome.
It's like being family. You're just going to a family member's office.
Right.
Now, I will say that I was really anxious about the fact that this guy told me that there's shots in the knees, and I'm going like, oh. And I can imagine, a needle that's 4 foot long,
right,
and all kind of stuff, and it is nothing like that.
Good. Well, yeah, we have a lot of patients who come, and some people say they're deathly afraid of needles, and so compared to your expectation of what the pain was going to be, how was the pain when you actually got the injection?
The injection pain?
Yeah.
It's kind of funny. When Dr. Tim touched my knee, it made me jump more than the needle. So that was kind of funny to me. It's like I wasn't even being stuck, and I'm already jumping. So, but when he finally gave me the shot, truthfully, it did not. It's like I was expecting some excruciating pain.
Sure.
And I've had shots for other things that are a lot more painful.
Okay. All right. Well, I'm glad that's the case. We do try hard to help people, not feel any more than you have to. And the reality is, if you take your time and take put the patient first, those injections don't have to hurt that much. So I'm glad. I hear horror stories from other patients who have had injections other places and have to do a lot of explaining to them, but most of them who've had injections in the knees other places say it's nothing like they've had before.
No, it's if I was rating it from a 1 being nothing to a 10 being really painful, it's probably in a 2.
Okay, great. Awesome.
I'll put it this way: if your knees are hurting, this shot's not going to hurt.
Yeah. So now tell me a little bit about, since you started, you've been through the treatment. The treatment that you're taking is something that can be repeated every 6 months. And you've been through one course, starting another one now. And so tell me, after that first course, that first 5 or 6 weeks after you were done, tell me about the difference between when you walked in here and when you walked out for the last time.
Well, I don't know that what I was doing when I first came in here would be called walking.
Wow.
It felt more like I should be crawling, because every step was like somebody put an ice pick in your knee. And so after I'm going to say probably the second or third injection, I started noticing that I wasn't having as much pain, but it was still having some.
Mm-hmm.
And somewhere around 6 to 8 weeks after the first shot, it's like I woke up one day and my knees aren't hurting. And I was going like, well, this is a freaky day, because they're supposed to be hurting. And that was 9 months ago, I believe.
Yeah.
And I still have a little twitch of pain every once in a while if I twist my knee, but I'm back on roofs. I'm back doing construction.
Wow.
I never thought that I would. I thought my days were over when I really did.
So you would, when you first started, you would not have attempted to get up on a roof when you first started with us?
I wouldn't climb a ladder.
Wow.
Yeah, I mean, honestly, it's all I could do to get in and out of a vehicle. If I was almost ready for a walker.
Wow.
I mean, that's how bad it was.
No kidding.
I know that sounds like this is impossible, and I felt the same way when I where I'm today versus where I was a year ago.
Yeah, no kidding. So part of your treatment was injections, which a lot of people end up getting injections. Not everybody. We don't do a cookie cutter program like some of the offices that you might see. Everybody's treated individually here, and we tailor the program to the individual. But part of your treatment was injections, but also part of your treatment was bracing. So can you tell everybody a little bit about the bracing and your experience and what it was with the braces?
Yeah, when I first had them on, I felt like I was Forrest Gump, and that everybody knew I had them on. But while my knees were healing from the shots or whatever, when my body's learning to cope again.
Sure.
So I'll be wearing the braces under pants like what I got on right now, and nobody knew I had braces on. I'm climbing on people's roofs, and I've got these braces on. If they could see what I had on, there's no way they'd let me on the roof, because it just kind of looks like I'm an accident looking to happen. But so I did conceal them because of just the way people thought about them.
Yeah.
But they're not hard to conceal. You can wear them under normal pants,
right?
And they're not intrusive.
Okay. Pretty light.
Yeah. Oh, really light.
Yeah.
In fact, between them and I also wear the sleeves.
Yes.
Because I told you that I was going to have a problem in the summertime, sweating to death.
Right.
And you had told me about the sleeves, so I got the sleeves, and when I did that, hey, it's all been good.
Great. That's awesome. Yeah, one of the questions we get a lot about the braces is, do I have to wear them 24/7? I don't want to wear them if I go out to a restaurant, and all those things are okay. I tell people all the time, there's no such thing as brace police. And so, you wear the braces. Anytime you're wearing them now is better than before, because you didn't have them before, right? So,
exactly.
So we can build on anything that fits your lifestyle. So I'm glad those are working. So now there's another piece of the treatment that you had that not everybody gets. It's an interesting story, but Glenn and I were on the same wavelength about something. He's always looking for treatment and the new cutting edge stuff, and so he brought this to me. And interestingly, we were looking at it about the same time, but this is a product called Body Protection Compound 157 or BPC 157, and Glenn and I were kind of researching at the same time, and he asked me about it, and I told him, well, oddly enough, I've been looking at that too, and so he was interested in trying it, so I ordered the product, and we tried it on him. But BPC 157 is something called a peptide, which is a small molecule. This particular molecule was designed originally to help people with gastric ulcers and stuff in the stomach because it's a stomach peptide. And long story short, they did some research and it helped with ulcers in the stomach. It also helped with healing wounds on the skin. And then people who were doing human trials were noting that it was helping with their joints. So we decided to do some injections of BPC 157 for Glenn. And tell me about that experience.
Well, I don't think you take nearly enough credit for what you just discussed, because what I had heard was my son-in-law, he kind of said, hey, there's this shot that you can give yourself and you do it every day for 90 days. And I'm going, oh yeah, I can see me doing that one. And so that's when we had talked about it, and then you came back and it was a one-time shot instead of 90 days worth.
Right.
And I'm going, no, that's something I could do.
Right.
My knees hurt so bad that I was ready to throw everything I could get my hands on at it.
Sure.
This may not be for everybody.
True.
But for me, I think between the gel, that shot, it's like a combination. Mm-hmm. 1-2 knockout.
Right.
Really. So, and you know what? If it's in my head, that's where I want it to stay. But I'm just saying that for me, it has been a gold mine.
Great. Well, I absolutely appreciate that because, like Lynn said, every treatment we do doesn't work for everybody. And to be honest, there are going to be some people who we don't have anything that works to help them. It depends on a lot of variables, and anybody, you're going to find some places around the internet that tell you that it's going to work 100% of the time, whatever their little gadget or drug is, or it's going to cure arthritis. And after 30 years in medicine, I can safely say that I haven't found a cure for arthritis, and I don't think there is one. If you look at a reputable source, you're going to see that there's no cure for arthritis. And there's a lot of variables that go into, how much wear and tear you've had on your knees, your body mass, lots of other things that can predict treatment. But I will tell you that Glenn is a good example of a lot of our patients. With the treatments that we do in our office, we do a pain and disability scale at the beginning of treatment and then at the end of treatment. And 92% of our patients will cut that number in half. Now, half of a very high number is not perfect, but I can tell you, for somebody who's living at a really high score, to be able to cut that in half is usually a really good improvement for them.
Well, and this, it's something that a lot of people are not aware of. And I just want to say that, like I said earlier, my car's parked right outside your office door. Mm-hmm. It's only 50 feet. Mm-hmm. And it was all I could do, walk 50 feet. I had to stop.
Wow.
And before I injured my knee, I was walking a mile a day, every day.
How about that? And
now I am back to 3 times a week, walking a mile with no pain.
That's great.
So if you've got pain in your knees, you need to come and see Dr. Tim. And don't wait too late, because I think that was one of the reason I'm able to recover like I am. is because I didn't wait till it was too late.
Yeah, and that's exactly right. That's one of those factors that I've talked about that, sometimes unfortunately people we can't help enough to their satisfaction. And I think a lot of it is people waiting a long time. Unfortunately there's a mentality out there that pain in your knees is one of the first signs of arthritis. But I can tell you, I x-ray a lot of people, we treat a lot of people who have one knee that's giving them the most problem. And just as a screening tool, sometimes we'll x-ray the other knee if the patient wants that. And I can't tell you how many times I've seen arthritis in a knee that doesn't hurt. And some of the things that we use, the vast majority of things that we use are covered by insurance. And one of them in particular is a preventative. And so if you can prevent an injury from happening, preventing it from worsening, help slow down the progression of that arthritis, then like Lynn said earlier, if it's another 1 year, 2 years, 5 years, or 10 years later that you have to have a knee replacement, or maybe never, then that's a win. And I think a lot of my patients are happy about that.
Yeah, I mean, it's kind of like having an old car that you got to grease the front end once in a while.
Yeah.
And that's the way I'm feeling. It's like I'm just getting my front end greased.
And that's great because and that's another thing is your body requires maintenance just like a car. And so one of the questions that we get, because we have people who come in and have a treatment, one of the treatments that we do, insurance will only pay for it every 6 months. And so if we have them come in, we have them scheduled for the next 6 months. Sometimes we'll call people and they'll say, I don't have any pain. Why should I come back? And the answer is, like we talked about, the preventative. So, you certainly, number one, you don't want to get back to the pain you were in before. And number two, if that medication is one that you're receiving and slowing down the progression over time, then it's going to be that much longer before it maybe doesn't work as well anymore.
And as far as money goes, my insurance was a bottom of the barrel, so it did not cover this. But when I looked at it, the cost, it costs less than your cable and a pizza every month.
How about that? I never thought of it that way.
So, is your cable and pizza so important, more important than your knees? So I'm going like, well, that's a no-brainer.
Yeah, that's a great way to think about it. I never thought about that. We see so many people who say they just want to go out and walk again, or get back to work, or they want to play with their kids or their grandkids, and it's hard to put a dollar figure on that. Again, the vast majority of things we do are covered by insurance, and so if you have insurance and have a plan, or if you have Medicare, Medicare generally will cover 80% of what we do, and if you have a supplement, we have lots of patients who have Medicare and a supplement who don't pay a dime for anything they get in the office. So, we always have a conversation about those financial things before we ever start treatment. My office is very much, we very much understand that money is tight for everybody. And so we want to make sure that we have those conversations, so we'll be honest and upfront, and upfront about the cost. And so that's hopefully will not be a burden or a problem, and at least you're going to know, and you don't have to think about it anymore.
Yeah, and my sister's also a patient, and she waited way longer than I think she should have, but now her insurance is covering 90% of it.
Okay, great.
So I honestly, and you said something just a minute ago that really is important. Anybody of any age, and that is that I'm able to go and have a walk with my wife now that I was not able to do.
So Glenn has been walking around doing things that he's gotten back to doing, and that's just awesome that you're able to do all those things again now. So what is your plan going forward? Are you going to kind of play it by ear, or you're going to stick with what works? What's your idea about how you're going to proceed?
It's like I said earlier, it's pizza and cable.
Right.
And if that's all it costs me, this is my plan the rest of my life until I know there's going to be a point that just because I have not been nice to my knees, that I will probably have to have some kind of knee surgery.
Sure, maybe.
But it is not in my plans right now.
Right, that's great.
And another thing that a lot of people don't think about, and that it just dawned on me, is it's not just the pain in your knees. It is not being able to get up out of a chair. It's not sleeping because the pain in your knees wake you up in the middle of the night.
Yikes.
There's a whole lot that goes on. It's not just the pain when you're walking. And a lot of people, I don't know if everybody's like me or I'm just one of those special people, but it was pain 24/7.
Wow.
It was not just
when you're walking.
Yeah,
we do have a lot of people who talk about night pain, not being able to get good sleep, and they're always tired, and just that. Also, when your body's in pain, it just drains you. You walk around almost like you're in a zombie state, just because it just sucks so much out of you. I have people that have told me they're not as nice to their family, they're not as nice to their friends, they don't go and do things that they used to. All those things too, not engaging in your normal activities. I mean, it can lead to some depression in some people. And so any of those things we can do. Chronic pain it's not news that chronic pain can really play a lot of problems with your mental health.
And I've got not a lot of friends that have knee replacement, but I got quite a few, and there's not a single one of them that have told me that they wish they had got their knee replacements done sooner.
Really?
There are a lot who tell me, keep your original knees as long as you can.
Wow. That's a great point too, because I see people every week either sending messages through Facebook on our ads or our Facebook page. They send messages and say, I've had a knee replacement and the doctor says there's nothing he can do. The guy who did the surgery said there's nothing he can do to help other than me taking pain pills. Is there anything you can do? And the unfortunate truth is very few of the treatments we do can be done on a knee that's been replaced. We have a couple of things, but the reality is there are so many people I see who either have had both knees replaced and I just have to tell them that there's nothing we can do, or I have a lot of patients who come in who've had one knee replaced and they tell me, I am with you till the end because I am never doing this again.
Yeah.
And they had a terrible time. I've had people who have come in and had to have what's called a revision surgery. So they had a knee replacement and either it failed or they got an infection and then they had to have it redone. And that is a lot of surgery, and that second surgery, that revision, is a huge surgery.
And and one of the people is my dad, who had, because this wasn't around when he was getting his knees done.
Right. It
was just knee replacement was your only option.
Right.
It's not our only option anymore, and so it's time to really. You live in America, the best medical country in the world, and we have it.
Yeah, that's great.
I mean, to me, this is a dream come true.
That's awesome. Well, Glenn, I really appreciate you coming by. Yeah, I mean, it's so good that people can hear your story, and I'll be very honest, as this. I have a lot of patients like Glenn, but not everybody. I mean, there are people that doesn't work for, and I'll promise you the same thing I promised Glenn. is we'll be honest up front with you, and we'll do our best to help you and do everything we can to help you get, hopefully, back moving like Glenn's going.
And if you want to hear it straight from me, ask Dr. Tim for my number and give me a call, because I'm telling you, I'll tell you, this is the best thing that's ever happened to me, except for when I got married.
Nice. Thank you very much.
Thank you.